welcome to session one, Oral Health Matters for Moms to Be. And we're glad to have you guys here today. And just know you're not here. We're not trying to make you dentists or anything like that today. We just want to give you the information and the knowledge that you need to make you confident, to help make you confident in the community where you're serving. But before we get into the actual program and everything, guys, I just wanted to go over a few disclaimers. And I wanted to ask again, has everybody signed in? If you haven't, in the chat box is a link and there's a QR code on the next few slides that you can use to sign in with your phone. It's very important to get everyone to sign in. On this next one is a disclosure for the speakers. That we have no relevant financial relationships to disclose. Are most of you familiar with the ripple effect? The ripple effect is pretty much we train you here with Train the Trainer, and that you would go back as community professionals in the community to work with the families that you serve to better equip their child to have the habits they need for brushing and to improve oral health for young children in the community. That is what the whole purpose of what we're wanting to do with Train the Trainer. And that again is basically to train other folks to go out in the community to help us reach all these families, to help make oral health better for these kids, especially the kids before they get into school, because those are the ones that are really suffering with tooth decay at this time. So after this training, you will be able to discuss why it's important for the oral health care of mom and baby. So before we get into the program, I'm going to just share a little bit about the Children's Oral Health Coalition for those of you, excuse me, that are not familiar with this. But our goal is to improve the oral health of children in Tarrant County through collaboration. And we do that collaboration through, it's about over 50 coalition members. And we have two committees that does the work of the coalition. And you can kind of see here the different areas of where we have participation on the coalition. And I would say to you, if you're interested in being a member of the coalition, we'd love to have you, because to me, there's no wrong door or health. As Dr. Fuqua likes to say, we all have teeth, right? So there's bound to be something that your organization or somebody that you know can do to help us reach the families that we're trying to get to. So we'd love to have your involvement. There's 4 focus areas for the coalition. It's awareness, education, prevention, and advocacy. And I mentioned to you that we have 2 committees. The Community Awareness Committee mostly focused on awareness, education, and prevention. And advocacy is done at the organizational, local, state, and national level. So basically, everything that you do on some level will fit into some of those focus areas. And if you can identify, I'm happy to help you identify those areas at your organization. So let's start with a little quiz. Truth or false? How are y'all feeling about a quiz this early in the morning? Chat box, thumbs up. Good in the chat box. Okay, here we go. Question 1. Baby teeth are not important. They're going to fall out anyway. True or false? I'm going to need to hear y'all respond.
I said false.
We have a false in the chat box.
Okay, I was going to say, I'm good with y'all unmuting yourselves to respond. I need feedback. And it is false. Do you know why it's false? Okay. Baby teeth are needed because they have adult teeth coming in and they need them to chew and to talk. And Dr. Fuqua will share more in a little bit. Next one. Untreated tooth decay can cause infections in other parts of the body. True or false?
True.
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 That is very true. Very good. Y'all on a roll. Tooth or false? Question number 3. A pregnant teen or woman should skip visiting the dentist.
False.
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 Y'all are good. Question number 4. Tooth decay isn't contagious. You can't catch it from somebody else.
False.
Who's false, false? It
False.
is.
Yes.
It is. And we'll talk more about that later. So now I will turn it over to Dr. Fuqua, who is our speaker trainer for the day. Dr. Fuqua.
Thank you. Let me get this mask off. So the first thing I'm going to do is give my disclaimer here that I am in a very large room with one other person, which is Leah. I am taking the mask off, so we are very distantly located from each other, and Elaine is in a completely separate room. So just wanted to say the disclaimer, but I kept my mask on until it was time to talk. So I hope everyone can hear me now. Let me do exactly what Elaine did earlier and welcome all of you this morning to be a part of this training. This is a chunk of time for you to take out of your busy work schedules to be a part of this. So we really appreciate that. And I'm super excited as a dentist to see the fact that you're interested in the oral health of either the communities you're in, the communities you serve, or families or children that you touch. So just a little bit about me. Elaine already introduced. I'm Dr. Tanya Fuqua. I am a dentist, and I am actually the director over child oral health under the Center for Children's Health here at Cook Children's. A lot of titles in there. However, I've served more in an administrative role here at Cook Children's, but I am in private practice part-time with my husband, who is also a dentist in the South Lake area. So I definitely keep my hands wet, see all this stuff all the time, and really keep up with what's happening in the realm of oral health. So let's go ahead and kind of get this party started. I will say that I am, first of all, being constrained to one spot so you all can see me is very difficult for me. I love talking with my hands. I love walking. I love engaging our participants. So this is a little hard for me. So bear with me as I might kind of get out of the screen sometime or do something crazy. That's just me trying to get everybody engaged in the excitement that I have. The first couple of slides are kind of introduction of why we're even here today. Why are we even talking about oral health? You took a little quiz. I sounded like most of you were getting that information correct. So that's very encouraging. However, I'm sure the families you serve or the communities that you're in, they don't understand this stuff. They have a true disconnect of the oral cavity to the rest of the body. And we're here to help you to learn the importance of oral health and how it impacts your overall health. So we're here to provide you with oral health information that is hopefully relevant to your everyday work. We're going to use words. I am not here to make you a dentist like Elaine said earlier today, but we're here to educate you enough because you are the boots on the ground, the people out in the community, and you have a huge opportunity and impact to touch families and talk to them about the importance of their oral health. Go ahead, we'll go to the next slide. Yes, please. Thank you. So a few little facts. Tooth decay is the #1 chronic illness in young children. Did you know that tooth decay or cavities is 5 times more common than asthma? And you hear about asthma being such an issue, and it is. So if you think of asthma being, everyone knows what asthma is, people understand the importance and the severity of asthma can take, and dental cavities is 5 times more common than that. Cavities are 4 times more common than childhood obesity and 20 times more common than diabetes. And I know that all of you know about asthma, obesity, and diabetes, just from the nature of what you do and hear out and about. According to the Surgeon General, in 2000, okay, reminder, we're in 2021. In the year 2000, the Surgeon General at that time said that dental caries or cavities was a silent epidemic. So basically what we're saying there is that cavities were out of control. Dental caries is so common, and that's a problem. And unfortunately, fast forward to 2021, we're still in the same boat. This is why we need all of you to help get these messages out in the community on the importance of oral health. It's sad to me as a dentist to know that we have not made enough progress, and it's not for the lack of trying. It's just because the nature of the beast and oral caries being such a huge problem. So a few more facts to share with you, just to show the severity and the importance of this. 40%, the research tells us, and this has all been documented, and you'll see some of the sources at the bottom of the slide there, but 42% have tooth decay of children ages 2 through 11. 2 through 11. Just thinking about those baby teeth, 42% of them having decay, and children can't explain what or when their teeth are hurting or what's happening or why they don't feel good or why they're not eating. 28% of the 2 to 5 year olds have tooth decay. And then by age 3, the average child has had about 3 teeth with cavities. Approximately 1 in 4 children ages 3 to 5 and 6 to 9 years living in poverty have untreated tooth decay. This is an issue. And the earlier we can start with changing the habits of parents and teach them how important their baby's teeth are before they even come in, we will have made huge strides in the right direction. Next slide, please. So, bad teeth affect children in school. Just think about yourself. When you have we'll talk a headache. You have a headache. You feel like you can't function. It makes you kind of just feel yuck all over. You can't concentrate. Well, what about a child who has a cavity and their tooth is hurting? They're 3 times more likely to miss school. I don't know, I can't see any of you all right now, but I will say, if any of you have had a tooth that's hurting, you know what we're talking about. And it's sad to know that children are feeling that way, and they usually can't explain why. A child suffers from dental pain, then they can't eat, they can't chew, they can't get their proper nutrition. Then they can't pay attention in school. If they can't pay attention in school and aren't at their full capacity, then they're not learning. They won't be able to potentially sleep well, get the rest they need to be a well child. Children are embarrassed. Even at these young ages, they're embarrassed to show their teeth. Kids are not cruel at this very young age of 2, 3, 4, 5. They're just curious. So they'll ask, why do your teeth look that way? Why do your teeth have black spots? They're not trying to say that at that young age to be mean. They're saying it because maybe their teeth don't look that way and yours does. So I'm going to ask. So can you imagine being a child going through school and hearing all that, feeling the pain? This is serious stuff. So we want to make sure that we're addressing things way early on. And that's why this portion of our conversations are going to be almost before the child is even born, and then going through their infancy. So like I said earlier about the Surgeon General's comment about a silent epidemic, we all kind of know this word now, right? Because we've been living in a pandemic. Now, hearing back and knowing that this is what was said in 2000 and it's still the same, the statistics show that 52 million school hours are lost each year because children are in pain and they're not able to be sitting there in class functioning to full capacity. So let me tell you a few more facts here, not to fill your brain with all these numbers. And this just shows the main thing I want you all to get out of this is the severity level, the high numbers of what we're seeing as we're surveying, seeing these families, seeing kids coming through our emergency room here at Cook Children's, or having to have dental care at age 3 to have 16 baby teeth worked on. The hospital is not the place where children should have to come for dental care. 46% of parents reported in Tarrant County through our Cook Children's survey that the 46% of the parents reported that they did not know the correct age for a child to visit the dentist. Well, I'm going to tell you now, and we're going to say it a couple more times throughout this training today. It's age 1 or before if you have concerns as a parent, or if you see something in your child's mouth. This is something that we need to train our families, our the women, our young teens that are unfortunately a kid having a kid. 57% of parents report that their child's dental health did not have an impact on their overall health. That was in the Cook Children's Survey. Parents saying, over half of the parents that responded said their child's oral health does not impact their overall health. False, not correct. The mouth is connected to the body and it does affect your overall health. Let me take a quick sip of water. Sorry, guys. So this is the response that the parents gave. How does a child's dental health affect his or her overall health? 10%, a lot. 11%, some. 13%, very little. 57%, not at all. And then 9%, I do not know. That's a true disconnect. And we need to connect the mouth to the rest of the body. This is a huge opportunity for you all who touch family, who touch children, to impact and make a difference in this. Because again, dental or oral health disease, it's 5 times higher than any other disease or medical issue out there. We need to connect, and go ahead, Leah, we showed those slides. We need to connect oral health to overall health. We need to show the importance of what the teeth can do. They're just not there to smile and look pretty, though we hope they would be, right? But we all have teeth, like Elaine said, I like to say, and even Betsy loves to say this. This is one thing that all of us have in common, from a child to elderly. We hope we all have teeth that entire time that we're supposed to have teeth. And we need to take care of them. People are living longer than they ever have before. They need those teeth for a whole lot more years. Dental decay is not just a cavity, or like I like to say to children, sugar bugs. This is actually a bacterial infection. A cavity it's bacteria. It's bacteria that's eaten away at your tooth. And when it's let to go out of control, then that becomes an abscess. When the body's not able to help and the cavity is just going crazy, then you go all the way to, a potential abscess if you don't take care of things. I'm going to throw this in here to just give the impact here. Oral health, your top teeth. If you get a cavity, it's not taken care of, starts getting out of control, that becomes an abscess. And you're going to see some pictures earlier. But a top tooth with an abscess can spread to the brain. A lower tooth that abscesses can spread to your heart and lungs. Yes, people die each year because of a cavity, because an infection started from a simple cavity that could have been taken and gotten under control way far before they ended up having their skull drilled into to drain an infection that started with a tooth. So that's enough to scare you. Let's start finding out a little more information so we can figure out how to impact this and how to not allow children to start out their life with cavity. Looking at a mirror, the mirror or the image you see in a mirror is really a lot of times what's happening with your overall health. So if you have cavities or gum disease, periodontal disease, saying some of these words like periodontal disease and gum disease, or gingivitis or periodontal disease, that affects the gum tissues and the bone around your teeth. Cavities are the bacterial infection that starts, and you're going to hear in a little while how that starts. But the overall impact is things that can happen is bad breath, an impacted immune system. If your body is trying to fight off cavities, that bacteria that's in your mouth, you actually, if that started first and then just say you get something else, your body doesn't have enough energy to deal with a bunch of different infections or problems. So your immune system is knocked down. Or what if you got sick first and your immune system has already started working on something else in your body and now you're getting cavities? That cavity might spread quicker because your body's not able to fight that off as easily. Respiratory infections, talking like I talked about lungs and heart. Heart disease has been tied to dental caries, to cavities for years, and it's still proven over and over and over again that those two connect. Diabetes. Anybody who's been diagnosed with diabetes, they really have to stay on top of their oral health because the problems in the oral cavity can spread quicker and have much bigger problems or concerns if you are a diabetic or have someone that you know is a diabetic. Pregnancy problems. We'll talk about this a little bit more, but when this bacteria gets out, you know, the bacteria doesn't just stay on your tooth. We swallow all day long. We swallow our saliva, we swallow our drinks, we swallow our food, and guess what's getting attached to that and going down? Bacteria. So you're swallowing this. This gets in your bloodstream. Eventually, if this stuff is not taken care of, it gets out of control. So we want to make sure we don't even get there. Go to the next slide. Now I'm going to, because we hear this over and over and over. And I have been in dentistry for a very, very long time. I don't want to give away my age here, but that doesn't matter. But I've been in a long time and I still hear this today. Well, baby teeth aren't that important. They're going to fall out. My child doesn't eat. Well, why do I need to get that done? It's just a baby tooth. Oh my goodness, that breaks my heart every time I hear those kind of things. But it is said over and over and over. Baby teeth are the precursors to getting your permanent teeth. The baby teeth train the permanent tooth where to come in. So it needs to be there, or there's nothing to guide that adult tooth. Facial form. I'll just bring up the best picture I can kind of, that you can have a visual in your head. Think of grandma who doesn't have her dentures in. What do? Their lip sinks in. They sound funnier. They don't talk as well and crisp because they don't have those teeth there to help them pronunciate. So they've got to learn to be able to talk and speech by having the teeth. If you think about a child or someone when they first lose those front baby teeth, okay, everything's healthy, they're good, but it's time to lose those baby teeth, and they get that window in the front, they kind of talk like this with a lisp because they don't have those front teeth for their tongue to touch and to help them pronunciate the words correctly. So if a child loses baby teeth or they're impacted way earlier, when it's crucial for them to be learning how to talk, then their speech is impacted. If they don't have teeth, they can't chew the food properly. They can't eat to get their nutrition. That's a problem. And of course, what all of us like to do is, doesn't it make you smile when you see someone else smile? That just lights up a room. And if a kid has a bunch of cavities, they may not want to smile. They may not want to show those teeth. So just thinking about those basic things that impacts everyday life of a child and yourselves. So the arrow there, I've got the ladies pointing out. If you'll look at the top middle picture, that's an abscess. That's from that brown tooth. If you go straight below it, those are 4 front baby teeth right there in the front, and one has abscessed. It can look like a big red dot like that sticks out, kind of like a bump. It could be full. It could make your lips swell out, or it could look like a little pimple and be white in that area. Those are all signs of a bacterial infection that's gotten out of control. It's an abscess. Look at the picture at the far left. That is a child of 5-year-olds upper jaw. That is what her upper teeth look like. There's 10 there. Can you see them? No. Pretty much what you can see is there are 2 canines. Those are the 2 baby deciduous canines. This child had to have the 8 remaining root tips and parts and pieces of 8 other teeth removed. Guys, we need to prevent this. Dental caries is 100% preventable, but you gotta start early. Let's go ahead and go to the next slide. Just to give you a visual of what's happening. Baby teeth, when a child is in utero, okay, so the mom's pregnant, the baby's in utero, the baby teeth are starting the buds, kind of like a seed. You think of planting a plant. There's a seed first and then it grows. The seed is there and the baby teeth start early development while they're in utero. Permanent teeth are not even in the picture yet. When a child is born, shortly after they're born, the permanent seed starts developing and the permanent teeth start to come into effect. So I say all this because baby teeth are so important, and baby teeth begin when in the mom's tummy, in utero, when they're growing. So this is why we want to discuss today of the importance, because those baby teeth are being impacted before they're even born. Go ahead and go to the next slide. So we talked about cavities, giving you these statistics. Oh, yuck, this is bad. Well, let's kind of describe what the process is. What causes tooth decay? Well, sugars in food, or food that breaks down to sugars, like carbohydrates. Carbohydrates break down, like those breads. Think about the carbohydrates. That stuff breaks down, crackers, that stuff breaks down to become sugar. Well, we all eat, and we all, I'm sure, including me, eat things, that aren't necessarily the healthiest for us. But what happens is bacteria develops in our mouth every day, all the time. Yes, even my mouth, the dentist. We all produce bacteria every day. That's why we have to brush and floss and do all those good oral health care, because we're all going to produce bacteria. But when that bacteria forms in our mouth and develops a plaquey, kind of gushy feeling on your tooth, and then you feed the bacteria, the sugar, the bacteria goes crazy and produces acid. That's kind of the end result of that sugar combined with the plaque that develops on all of us. So this is why it's so important to brush your teeth before you go to bed, and go to bed with a really clean mouth, because bacteria likes to go crazy at night when you're sleeping and you have no saliva flow. Acid can attack and cause a problem. I mean, it takes 20 minutes. I'm here to tell you that every day our bodies go through this process in our mouth. We develop plaque, we eat, it feeds it, we have acid. We drink water or we clean it out, we brush our teeth, and then our pH, that acidity comes down. But acid attacks and starts eating at the enamel if it's left there long enough. So this is why we say brushing your teeth multiple times a day, drinking water, rinsing out your mouth with water. Doing these kind of simple things will help this process to continue to develop. And like I said, guys, this happens every day, all day long. We eat, we drink, our plaque is forming. We have to keep that out in control so that we actually don't go to that very far right lower picture, tooth decay, so we don't end up with that black hole. Go ahead and let's go to the next slide. This is another picture that kind of gives a good demonstration of what plaque is. Plaque is that soft fuzzy stuff. If y'all ever take a toothpick and just kind of go around on your tooth before you brush or something, but not after you've eaten, before you brush or something, go around it and you'll see just kind of a little bit of a white fuzzy stuff. This is the plaque that we're talking about. It's sticky and it kind of acts like, lack of better words, and since I can't be in front of you, I'm going to give you a mental picture. Plaque is like Velcro. Think of having Velcro sitting there, and then food comes in and it sticks. It sticks to the Velcro, and then it sits there. You brush the Velcro off, okay? So the bacteria floats around in our mouth. That sticky substance of the plaque forms every day. And this is why we have to constantly talk about not only how many times a day you brush, but for how long do you brush, and doing that thorough job. We're going to get into those details tomorrow about actually how to brush, how to floss, because believe it or not, there's a right and a wrong way to do it. And we'll be here to teach you how, so you can know for yourself and then can go out and teach people. So here is a diagram, kind of a beginning stage of a cavity and then kind of processing it on. So just like as you would read, let's go through the stages of a tooth decay or cavity from left to right. On the left side, you see the nice, pretty white enamel. You see there in the diagram kind of that pink color with little squiggly lines going through it. That's the nerve. That is where you get your blood supply to your tooth, and that is where the nerve endings are within your tooth, in what's called the pulp. So at this point, it's small, it's all in enamel. That little black hole up there, that is tooth decay, but it's small at that point. If left untreated and you don't get it taken care of when it's small and you don't brush enough or get fluoride enough, it progresses and it'll go into the next layer of tooth, which is dentin. And that's kind of outlined in a little faded gray kind of color. You can see they're outlining it there with a cursor for us. That is the dentin. So there's enamel, the hardest substance, tack, 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 that's our enamel. That is hard stuff. It is the hardest substance almost to mankind of anything else you can think of. So think about that. Bacteria can eat through that hardest substance that is to mankind. When it gets to the dentin, that's a softer layer of tissue. It's a softer layer. So all of a sudden, if it gets that far to the dentin, it'll progress sooner. It'll go across faster. And then it'll go to the next part, which then gets to the nerve. So you hit enamel, still didn't take care of it. Now it's in dentin. Oop, it's going faster now because that softer tissue. Now we're into the pulp, the nerve. I'm going to tell you, the picture that y'all saw earlier of the kid's mouth, I said, did you recognize that? Guess what? The nerve was coming out of 2 of the front teeth. And can you imagine having your nerve just exposed? That's terrible. That's painful. That's where your blood and nerve supply comes from. If things are not taken control, this is where, if it gets this far, guess what? You either got to have a baby root canal because it's a baby tooth, which is called a pulpotomy, or it's an adult tooth and you're getting a root canal where the tooth itself is intact, but you're cleaning out the nerve and blood supply from the tooth so that the tooth is not painful and the disease cannot progress. Now, the very last picture where you see that cavity's gone all the way through the layers, it's in the nerve, still hasn't been taken care of. Now we have an abscess, that red dot area at the bottom of the root. So in the picture when they were showing the red dot above that baby tooth and it's kind of high up on the gums, well, that's where the root ends. The root ends up here, and that's where the abscess came out from the gum tissues. Our bodies are remarkable. It tries to handle the bacteria. It tries to do what it can, and it'll just start trying to drain that abscess, that infection into the mouth. So again, that can lead to the bad breath with having an infection, an abscess like that, as well as having like gum disease or gingivitis or something like that. Let's go on. Now that we're all going, oh my God, this is what happens. Well, this is why we got to start early. All that bad stuff I just talked about of the process of a cavity, we got to start taking care of this before there's even teeth involved. The importance of maternal health, not only is the mom's oral cavity important, but if the mom doesn't have her oral cavity and everything taken care of in her mouth and everything healthy, that can actually impact the baby. And we're going to go through a little bit of this to talk about what can happen and why it's so important for us to target the mom first, right? not only because she's pregnant, we want her health to be good, but we want her baby's health to be good as well. And I'm going to show y'all, and this is something really great that is distributed through our Children's Oral Health Coalition. There are so many great pamphlets that I wish y'all were here in person and we could just hand out all this great stuff. But Elaine will get all this stuff to you. You just reach out to her anytime. You give her what you want to be able to share with families, and she will make sure you have access to it. So, a mom's health. Why is it important for mom's health? Well, maternal for her health, we don't want her to get pregnancy gingivitis. That's where, we talk about and people understand, okay, when women get pregnant, they have cravings. Women get pregnant and they don't feel good and they get nauseated and they have those issues in that first trimester of throwing up. Well, guess what? All that with just throwing up, just the mom, her body dealing with that, if she's throwing up every day and all the time or quite often, that's a lot of acid coming, more than what's normally produced in the body. And that can affect the teeth as well. So not only can the mom get pregnancy gingivitis, she could have been perfectly healthy before. When you get pregnant, our body has to do a lot of changing, and there's a lot of hormones flying, and hormonal stuff does impact a lot of things within our bodies. So pregnancy gingivitis, those red, swollen, bleeding gums. It's important, as you can see, they're circling it with the cursor there with their pregnancy gingivitis, that puffiness in the gums. Even getting little pregnancy tumors, large red bumps, as you see in the lower picture with that growth kind of going on there, that weird, funny little papilla that goes between the teeth, that can get infected. And you can have some of these things around the mouth. Pain in chewing, you're not eating well. Maybe the mom has a lot of cavities. Maybe mom has a lot of disease going on potentially. And if she's not good or her body is, again, we talked about how it impacts your immune system. Well, guess what? If everything the mom's got in her, it's going towards the baby first. I will tell you, it's going towards the baby first to take care of baby. So when mom gets something, it's really important to take care of her because that immune system just cannot take care of everything, mom and baby, to the capacity it should. Pregnant women also tend to, what did I say? Eat more, eat a little more often because they do get nauseous. So they're snacking a little bit all day long. What did I say? Every time you eat and then you have food and it sits there, okay? Food plus plaque equals cavity. So that acid formation. So it's really important for moms to be rinsing their mouth throughout the day, brushing their teeth, making sure they're cleaning stuff after all that snacking or that late night snacking and then going to bed. And by the way, pregnant women tend to have cravings, don't they? And they start eating and drinking things they don't normally eat or drink. You could have a pregnant female that's never had a cavity in their life. They get pregnant and then they don't go to the dentist because they don't think you should go to the dentist. And the next thing you know, they've got cavities. And we see them after they've delivered the baby and they come in, they have 5 cavities. And they've never even had a filling before. So we want to make sure that we're helping that pregnant mom to take care of, herself and make sure she doesn't have issues. So with the next slide talking about, and I mentioned that pregnant women they're not really sure if it's safe to go to the dentist when they're pregnant. Well, it is. Not only is it safe, but it's extremely important because we've got to take care of mom. If mom has dental disease in her mouth of any kind, gingivitis, periodontal disease, cavities, she could actually have a premature labor because of what's going on in her mouth, meaning that mom may go into labor sooner than she should have. That's not good. They could end up having low birth weight babies because of what's going on with mom and her oral cavity. That disease, that infection, that bacteria can cause the mom to have issues through her pregnancy or towards the end, and that's not good. It is completely safe to see a dentist, and it is, you will see the little icons on the bottom of the different organizations that are standard of care, our best practice, our organizations that tell us what is safe to do. And it is completely 100% safe for a pregnant woman to see a dentist at any time during her pregnancy. I will say that the first trimester and the third trimester are kind of those a lot of people kind of know this anyway, that's probably the not as best time to see. The best time would be during the second trimester, because that's when mom's feeling better. She's not having morning sickness. Things are kind of in control. She's not as uncomfortable. She's feeling better. That might be just not a good time to go. Could be the best time to go, but it doesn't mean you can't go during the first and the third trimester. Okay, it's very important. X-rays can be done. Our X-ray let it all the way to the top of the neck and the baby. Only taking the X-rays that are necessary to help that mom, but X-rays can be taken. Their teeth can be cleaned. They can actually have fluoride. They can have a restoration, a filling done. And people might think, oh, well, they could have a filling, but oh, if it's bad infection, or they can't go get a root canal. Oh no, yes, ma'am, they sure can. And why? Because if that mom is in pain and she's hurting, guess what it's impacting? Their blood pressure. When you are stressed and in pain and not feeling well, and maybe not eating because something hurts, oh my gosh, that's just a domino of many things that will happen to this poor mom. So the little bit of time and the little anesthetic it would take to numb them up, to get them taken care of, is totally outweighs any potential negative outcome, because the negative outcomes will happen if they're not taken care of. And guess what, folks? Even nitrous is safe. Most people know nitrous as laughing gas. Even that is safe. Matter of fact, they used to and still do use nitrous to sedate and help a mom if they're about to go, whether it's a hard labor or whether they're about to go through a C-section. They're giving the mom nitrous right there in the OR in the hospital. So it's completely safe to also be used in a dental setting. So, we went too far. All right, okay. Leah got excited with her buttons. So for home care for pregnant teens and women, let's talk about some of the things that we can do to prevent this mom from having issues through her pregnancy, or a concern to have any issues with their baby. Brushing 2 times a day for 2 minutes. Brushing 2 times a day, morning and at night before you go to bed. Can they get another brushing in there 3 times? Yes. Can they brush 3 or 4 or 5 times? Yes. But we're at the very minimal 2 times a day. In the morning, get all that plaque that's been growing in your mouth all night long when you're sleeping, get rid of that bad breath, and then you brush at night before you go to bed, so that you go to bed with a really clean mouth and no food and no other stuff in there, so that the bacteria doesn't have anything to eat on or grow on while you're sleeping. Flossing daily. Flossing is extremely important all the time, once a day, every day. It doesn't matter if it's morning, night, just once a day, every day. But for pregnant women, they get that pregnancy gingivitis. It's very, very common. Pregnant women will say, oh, I've been flossing all my life. All of a sudden, I'm pregnant, my gums are bleeding. I think something's wrong with me. They get freaked out, but the gum tissues will swell sometimes. And for some people, it's worse than others. So seeing the dentist is extremely more important at this time, because the dentist can help the pregnant mom to get through that pregnancy as healthy as she can. Using fluoride rinse daily, swishing with a fluoride that's over the counter. We'll show those things later on, but using a fluoride rinse is really good to do, especially at night before going to bed. Eating healthy. I tend to find that women may not always eat really healthy, but when they get pregnant, all of a sudden that's where they start. Because now what? They're growing a baby, and they're worrying about that child actually more and over themselves. So that's really healthy, really important to do, is to eat healthy. Drinking more water, definitely drinking more water, not only to help the oral cavity, but I mean, that's helping them overall health-wise. We'll show you in a minute about chewing gum with xylitol. I will say, gotta put in my dentist disclaimer here, I'm not about chewing gum all the time. Please do not chew gum all the time. Please do not chew gum for 20, 30, 40 minutes, an hour. Don't do that. That overworks the muscles and the jaw joint. That's like me doing my arm like this. My arm's meant to do this, isn't it? But it's not meant to do this for 30 minutes, just like this. You're gonna start hurting, right? It's the same with the jaw and the muscles. That's the best description I can give. So if you chew gum, the purpose of chewing gum and then chewing gum with xylitol, which we'll talk about in a second, is the fact that your chewing of gum, it triggers your salivary glands to start working. When we're not chewing or eating, our salivary glands don't really express a lot of saliva. But when we're eating, that helps get the food down. So by chewing gum, you're stimulating your salivary glands. And guess what? Your salivary glands have good, normal pH is in the saliva. It's a good solution to kind of rinse out and kind of help that acidic environment to become a little more neutral and less acidic. So chewing gum is really good. You can do that after eating a meal, having a snack, chew a little gum for a little bit. Great, you got your salivary glands going, rinsing out some of the stuff in your mouth and then throwing it out, okay, getting rid of it. Visit the dentist at least twice a year, at the very least twice a year, every 6 months. Now, sometimes when you're pregnant, or the dentist will ask to see them a little more often, maybe every 3 months or every 4 months. And that is to help the mom, if they're having issues, to help them to keep that pregnancy gingivitis under control, get those cavities taken care of, keep those teeth really clean, and to help them. And make sure that when you talk to parents, if they're like, oh, I'm just so big now, it's just hard, I'm so uncomfortable, make sure you tell them that you talk to a pregnant woman and say, talk to the dentist. They can do things to make you feel more comfortable. They may not have to lay you quite so far back so that you can handle that procedure. So just as long as anyone is very open with their dentist, they can get through the procedure in a very safe, healthy, and comfortable environment. So this slide, usually when we're in person, we love to distribute some of these samples of gum so that everyone can kind of look at it, chew some yourself, kind of see what we're talking about. Xylitol has become a very important ingredient or thing that has been added to gum and some mints. It's, of course, what we've got here is, well, what is it? Well, it's a plant-based type sweetener, but it's not sugar. It's not that full sugar, but it's like it has a sweetened natural sweetener in it that helps the bacteria, helps that Velcro I was talking about on the plaque. It helps that not be so Velcro-y, for lack of better words. It helps it not be as sticky. That xylitol kind of helps it make it a little smoother. So chewing that gum, getting or sucking on that mint causes saliva to flow to come out, and then that xylitol adds an added layer of protection. So these are some samples that Elaine put on the slide of maybe some products you've seen out there. If you like mints or you like gum, please look at the packaging. Just like people say to look at a packaging of food you're going to buy, packaging, if it has xylitol, make sure it's sugar-free. Make sure it's sugar-free gum. If you're not going to get something with xylitol, at least you do sugar-free gum, and don't chew it for a long period of time. There is the www.xylitol.org. Not everybody knows about the xylitol. It's kind of a hidden secret, and I think it just is because it's not advertised as much, or not really put out there in the public as much. But it has been a game changer. And it has been actually important for dentists, and dental hygienists will talk with their patients as they're cleaning their teeth and talk about this a whole lot more recently. So good things to try out, good little thing to keep in your purse, because I think I think the majority of the people here are women. So good thing to keep in your purse and bring out when you need it. Next slide. Well, we are in a pandemic still. People are nervous to go to we're nervous and maybe still are nervous to see a dentist. I want you all to know, if you think about it, when you've been to the dentist pre-pandemic, the dentist always was wearing gloves, masks, again, something over their eyes. They pretty much were already doing a lot of this stuff before, because we are working in such a viral, an area that things can be spread. And then we work in the oral cavity where maybe working on stuff where bleeding may occur, and we can get all kinds of blood transmitted type diseases. So dentists, we were always covered all the time. Now we just have a couple of extra layers. It is 100% safe to go to the dentist. Now, during a pandemic, even though it's in a pandemic and it's being pregnant, remember, the thing that can be more detrimental to a pregnant female is their body not being fully in check. And that oral cavity is part of that. So please empower the people, the families that you talk with, to just, if they don't feel comfortable, tell them to ask, to call their dentist or call that office that they're hoping to see a dentist in for the first time, so that they feel safe and so that they feel like they can ask questions and talk to that office. And let me say this, just because our Texas governor has removed the mask mandate for the state, the Texas Board of Dental Examiners is what regulates dentistry, not the governor. So we are still mandated in healthcare, not just dentistry, but in healthcare, to wear all the PPE, wear all that personal protective equipment. So you guys, don't be worried. You're still going to be asked to wear a mask into a dental office, and all the personnel there will all be wearing masks, and then they'll put on the full gear of protective equipment, the PPE, before they start treatment. So I just wanted to make sure I put that disclaimer in there, because all this information is great, and we would have never talked about PPE in past years with this the trainer, but I wanted to make sure that we took a moment to really express that and let you all know. So, what about resources to find a dentist, especially for pregnant teens and women? I will say sometimes dentists are a little concerned to touch it's almost sad to say, like, it's like the dentist doesn't want to touch a pregnant woman, as if they have something contagious. That's not what it is. They're just very concerned about the pregnancy, the health of that mama and that baby. But through it together, everyone can get a pregnant female taken care of in a dental setting, even if it means just the OBGYN needs to write a note to the dentist to feel comfortable to do whatever's needed. Or if a dentist isn't sure, they always call the OBGYN. Trust me. If they know a pregnant woman needs something, they're going to call and request release to treat that pregnant female, especially if there's been some other issues or whatever. Pregnant women need to stay very active in getting a dental home if they don't already have a dental home, with a regular visit, because as soon as the baby arrives, if the mom's body is not in check, you're going to see what leads to the next problem here. Pregnant women need to be able to find a reputable dentist. And I will say that Miss Elaine has, with the help of the oral health team here in the Center for Children's Health, has created a wonderful resource brochure that not only will help pregnant women, and this is the picture you see on here, any of you can request copies of this family dental resource brochure. It's nice, it's easy, it's in English, it's in Spanish, it's one packet, and it's about the whole family. So it's not, it will show little icons to where if that location, and these are free or reduced rate locations, okay? There's also organizations in this that can help to get the dental care, like either to pay for or to get coverage, or how to get on Medicaid or CHIP, or how to get to the dental school in Dallas. Fort Register Dental Society. There's funding sources in there to get help. So this is a small but mighty resource brochure because it has a lot of information in it. Well, I've talked about a lot. We're going to get into a little more details, but I'm going to allow y'all to all have a break. I've been talking a lot. I think you all probably would love to get up and get around. So I'm going to let this go back over to Elaine.
Thank you, Dr. Fuqua. Will you click the next slide, Leah, please? I just wanted you guys to know that we do have an educational toolkit that's available for checkout. And what you see are all the items that are available for that toolkit. And we'll talk a little bit more detailed about it on tomorrow, but I just wanted to kind of put this up and let you guys know that we do have that available to help with your education to families. Thank you. And we'll just take that break for 5 minutes. But I'm here if anybody wants to chat.
I will stay on as well too. So if anybody wants to unmute and
Or
ask a question, I'm
yeah, if
happy
you-
for you to do so.
Yeah, have questions for Dr. Fuqua, now's the time to ask.
Yes, I have a question. So how do you clean a baby tongue that has like white stain from milk, like a
Mhm.
newborn?
I am going to show you. Great question. I love that you're thinking that way. We're going to talk in a little bit about these little cloths and how it's good to wipe the baby's gums and
Okay.
tongue. And I will say, you're exactly right. That's a perfect description. Baby's little tongues stay white. And what does that mean? It means that the milk is sitting there, right?
Yes.
So the milk is sitting and causing that kind of white look, fuzziness almost to the tongue. That means it's in the mouth. Our tongues, all of our tongues, even a baby's tongue, all of our tongues are like, the best way I can describe it is like it's a shaggy carpet. Our tongues, if you look under a microscope, are like a shaggy carpet. And you have to brush your tongue when you brush your teeth, always. But a baby, of course, doesn't have teeth yet, just has gums and their tongue in their mouth. And so we're going to talk about wiping that. It's a very good question. And I'll get into a little bit more descriptor, even showing how to hold the baby and the importance of even wiping the baby's gums before there's ever teeth. And it's for that exact reason you just mentioned, because stuff is sitting in there. Yeah.
I have parents who ask me, is it better to use a water pick or floss? And I think that there's good attributes for both, but I didn't know what your response would be.
You're exactly right. What you just said is there's great attributes or great things that are for each one of those items. I will say this, absolutely nothing replaces true blue regular floss. Nothing does. And we'll explain tomorrow on how and what that looks like in the right and wrong way to floss. But I will say this, you all, when parents start asking personal questions, kind of like, well, what do I do with my, because that's all they have to relate to, right? Is their own child or themselves. And so when they do that, we want to make sure, hold on one second. I want to make sure y'all weren't hearing all the background noise. So anyways, whenever you're getting asked of what is better and you're asked about a particular item, I mean, only share with what you know, like information that's from here. And there's nothing wrong with saying, you know, that's a great question, Mom. I don't know the correct answer, but that's the importance of getting to a dentist, because they'll be able to help you to know what is best for you or what is best for your child, because there is not a one size fits everybody. There just isn't. So the water pick is really good. I will tell you, for people who have braces, that's really good. For people who have had a lot of dental work in their mouth, like crowns and bridges and implant or something like that, that is a good place to use the water pick, is when people have that kind of stuff going on in their mouth. But true blue, regular teeth need to be flossed. Floss is it. Floss is
Okay.
a trick.
And that's what I thought. And I mean, with my son, that's all I use is the floss. I do have a water pick, but I just do it because he likes the sensation in his mouth. But I still use a regular floss.
Mhm.
But I just wanted to know what your thoughts were on it, because there's several dentists who are encouraging parents to use a water pick. And you're right. It depends on their personal dental care, because it could be that they have special needs. It could be, you know,
Right.
many things that the reason why they were told that a water pick is best.
Mhm. And you know what, Brenda, you just said it yourself. You said, I still use the water pick, floss my kids' teeth, but I still use the water pick because they really like it. Ding, 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 ding. If it is something that excites your child and your child is stimulated or interested or excited about using a dental product or tool of any kind, I'm saying go for it, yes, because that's getting the child engaged and hopefully that will set them up for good oral health long term. There are some kids that just need that extra stimulation. They're bored easily. They won't keep doing so. And we're going to talk about some things tomorrow about some fun ways to get kids engaged and involved. And you just said one of those things, Brenda. But I never want to tell somebody they have to buy an electric toothbrush. Those are like $100.
Right.
Someone has to go get a water flosser. There's those now, water flossers, the water picks. I'm not here to say you have to get this. There is no way your child will not be able to be taken care of if you don't buy these. No, that is not true. A regular old, I'm going to lean a little here. This is a really big one, but just a regular toothbrush and floss done properly can be so effective. So, and I say that because I know most of you out there work with or target a lower income population. And if the only toothbrush they can get and afford is from the dollar store, I'd rather have that than nothing at all. Great questions, though,
Thank
Brenda,
you.
and a great comment for me to be able to elaborate on so it can help you all to know y'all are not the dentist. Anyone on this call, y'all are not you're not the expert in it, but you are the expert at helping connect families with resources, to connect families with the information they most desperately need. And the best thing I can say is utilizing the brochures and the items and the oral health kits and the baby infant kits and all the stuff that Elaine is able to provide for you all to be distributed out in the community. Use those things. Motivate those families, help them find a place to go to establish themselves with a dentist so that they get the proper information that's unique to them, to their family, to their situation. I very seldom say the exact same thing to every single solitary. I talk to the patient about what their needs are and what they've got going on in their mouth. So great question. I know I went a little crazy on elaborating on that, but it's so crucial. And I love it when I see you all out there in the community and you bring forth these great questions because you're hearing it, you're seeing it, you're living it. And I want to be able to give you timely information as well as relatable information. So thank you for those questions. And we'll try to allow y'all to have a little more time to stop during the second half so that we can engage a little bit more and maybe elaborate on a few things that y'all are seeing.
Well, if everybody's back, Dr. Buquay, we'll kick it back to you.
All right, thanks, Elaine. I hope y'all all got a little break and feel a little better, like you can get through this next half. We've given you kind of the background, the information of the why. What happens? What is bacteria? What is a cavity? How does that happen? What do you do? We've talked about how important it is for that pregnant mom to have her oral health in check so that she can do the best she can in having a healthy baby that's taken to term and they're not coming in too early and them having issues with her, so that would cause problems for the baby. But now we got to start kind of figuring out, okay, so we took care of mama. Mama's going to get all her dental care. She's going to be good. We're going to have a good, healthy baby here. Their baby teeth are developing because mom's healthy. She's not having issues. Because I will say one thing, and one thing that's not mentioned earlier, but I think it's impactful. And I think you've all probably seen different things in kids' mouths. And I'm not talking even looking in their mouth, just when they talk, you can see things, right? Babies who have teeth that look funny, and we'll talk about stuff later, but it's because if baby's teeth come in to the mouth looking funny, what did I tell y'all? Baby teeth are developing while they're in utero.
Mhm.
So if there's something you notice on a baby tooth, just shortly after it comes in, has these white rings around or really weird yellow, real dark yellowy kind of spots, or some striations, meaning little lines kind of in their teeth, that's because something happened to mom when she was pregnant. That means mom got an infection. Mom got a bad respiratory upper infection. She was on antibiotics for a period of time. Mom got a fever. Something happened to mom. And that means then that affects the baby's teeth when it's developing. If you see perfectly fine baby teeth, and they come out all nice little 20 baby teeth, and now they're starting to get permanent teeth, if something's going on with those permanent teeth that looks funny as they're coming into the mouth, then that means something happened to the baby when the baby was little, right? Permanent teeth don't start coming in until about age 6. So that means that baby had a high fever. Baby was very sick. Baby was on antibiotics constantly. Those kind of things can affect the permanent teeth. High fevers really will definitely affect baby or permanent teeth. So I just wanted to kind of clarify that and all the importance, because something's happening to mama, it's going to affect the baby's teeth. If something happens to the permanent teeth, that's something meant that happened to the baby. And that is one of the first things when the dentist sees the child, they'll start asking the parent, were they sick a lot when they were born? Because now they're looking at the baby teeth, or they're looking at permanent teeth. They're asking mom if it's the baby teeth, or they're asking about herself, or they're asking mom about the baby. What did they have when the baby was little? Were they sick? So let's keep in mind something here. You see the mom feeding the baby a bottle of milk. That's what they do, whether it's breastfeeding or it's bottled milk. You probably have heard the term baby bottle tooth decay. And why is that term there, baby bottle tooth decay? Because a baby drinks the milk from a bottle and it just sits there and pools in their mouth. And then you have the issue of when the baby teeth start coming in. So we want to make sure that the baby is not just leaving that in their mouth. And we're going to talk about how to get the milk out of the mouth. But the baby bottle tooth decay, the name, everyone thought the name changed over the years. And multiple years ago, the word baby bottle tooth decay was taken away because parents thought, or women who had babies thought, well, they're not going to get baby bottle tooth decay because I'm breastfeeding. Well, that's not the case. The same thing happens with breastfeeding. It's the problem of the milk just sitting in the baby's mouth after they've eaten. And you all know, we all love to see that sweet little baby and their eyes getting really sleepy, and you're like, oh, and you keep rocking them, and they finish, and then you let them go to bed, and you put them in the bassinet or in the crib or whatever to sleep. But guess what? That's pooling. Now, at the very beginning, they're eating every 2 hours. You're not going to be able to really wipe their gums every couple hours, right? But we're going to talk about what to do after those first several months and what we need to be doing and be more diligent about. So let's go on to the next slide. I talked about the baby bottle tooth decay being named early childhood caries because it's babies. This starts, people think they don't have teeth. How could they have a problem? They don't even have teeth yet. Yeah, But if you set them up for success when they're infants, you're going to see that best nutrition of breast milk, that great addition of if you're not breastfeeding and you're bottle feeding, that's the baby's nutrition. That's all they get is milk at this point. And they don't have teeth, but you have to set up the precursor for what happens. Someone asked, I don't know, not someone, Brenda asked during the break, and I don't know if everybody got to hear it, but talking about, man, what do you do about the baby's tongue? Every time, they've got that kind of white coating on their tongue. Well, first of all, I'm so glad Brenda brought that question up. Second of all, so glad she's even noticed that happens. Look at a baby's tongue. It keeps that white coating of the milk on there all the time. So we want to make sure that we start doing something about that before there's even teeth in the mouth, okay? Is wiping their gums. Their saliva just kind of pools there. The lip holds the milk up against those top front teeth. And that's why they usually get, if they're going to get cavities at an early age, it's usually the top front teeth. That's why you'll see baby teeth with like stainless steel crowns on all these baby teeth, or you'll see all these baby teeth missing by age 3 when they shouldn't be missing those baby teeth. But that's where the milk pools and sits on the gums, or then when the teeth come in on the teeth. Let's go to the next picture. So this is a slide that kind of shows you, gives you a great idea and start of what cavities and how they can form and develop. So a baby's issue with getting cavities will start even before the baby tooth comes in. And you'll hear and see in a little while about what we need to do early to prevent this. So let me paint you a picture. You see a visual here. I'm going to describe what's going on in each one of these pictures so that you can have a sense of what's happening. This is either baby bottle tooth decay and or drinking breast milk, and it's sitting there this whole time. So in photo number one, top left, that is a photo of a 20-month-old child. 20 months. So that's 4 months under 2 years. Okay. They're not even 2 years old yet. And they have been in severe pain. There's baby teeth there, but they're all decayed up on that top ridge. The photo number 2 on the top right, that photo is also of a 20-month-old with 9 teeth decayed. That child had trouble eating. They were low birth weight for their age. So not low birth weight as being coming into the world as an infant, but they are extremely small and malnutrition for their age. And they were in severe pain. The lower left photo, number 3, this is a 2-year-old, 2, with 16 decayed teeth. At this point at age 2, they only have 16 teeth. It's when they get closer to 3 that they finish out those last 4 molars and have 20 baby teeth. So 16 out of the 16 teeth that are present in that child's mouth had decay. 8 of those teeth had to be removed. The child was having trouble eating. They again were low birth for their age, and they also were in severe pain. Photo number 4, lower right. This is a 2-year-old child with 16 decayed teeth and also in a lot of pain. These photos come from the American Academy of Pediatric Dentistry, and this just paints, you don't even have to have a real life child. You can see it. You don't even need to be a dentist to see the severity and sympathize that, oh my gosh, that looks terrible. And I will say on the cursor, is it Leah, we do with the cursor, point out on the picture number 3, point out those 2 front teeth in the top, that one and that one. Do you kind of see a little dot there? That little dot in the middle of what's left of that tooth, which is just a root, that's the nerve exposed. That's out. That's not good. We can't have these children getting that way. They're 20 months old. This is so preventable. We should not have children. And guess what? When you're 2 or 3 years old, or you're 1.5, and you have cavities like this on teeth that you have, guess what? You're so little, you're going to have to be treated in an operating room setting, because children crash fast, but they heal fast as well. Only way to safely sedate a patient and have them comfortable to take care. Can you imagine having a drill going 20 miles per hour here and you're chasing a moving child? No, there's no safe way for someone to not get trauma and or be injured or be scarred for the rest of their life of being scared of a dentist. They have to safely, anesthesia-wise, be treated and sedated in a hospital setting. And that's the last place we want kids to go for dental care, for just regular dental care. We don't want them getting here. Let's go to the next slide. So we've talked about all the big, bad, and the ugly, and what happens, and a little bit of why. So what can we do to prevent this 20-month-old, this 16-month-old? Some kids get baby teeth at 6 months of age. Very normal for the first baby tooth to come in by 6 months of age. And usually it starts from the lower and the 2 front lower teeth and move on to the upper next 2, and then the lower, the ones on either side. With this, you need to start early. You've got to, as soon as you're feeding the baby, and you've got to be wiping their gums and stuff. And we're going to talk about that. Swabbing and cleaning the child's mouth out several times a day. Why is that important? Well, you're pre-setting them up for a good, healthy dental routine. Second of all, you're getting rid of the milk just pooling and sitting there in their mouth. Third, you're setting them up to be a good patient when they go to the dentist for the first time by age 1. Because if they're used to you sticking your finger in their mouth all the time, they're going to be used to you sticking something in their mouth as a toothbrush when they start getting their first tooth. And then they're going to be used to a dentist or dental office trying to get in and look at their teeth. So the earlier you cannot start any earlier than when they're infants and they're drinking milk, whether it's breast milk or a bottle, okay? Brushing the teeth should start when the first tooth comes in. If that's 6 months, 9 months, 12 months, whenever that first tooth comes in, you're going to start brushing them. So you're going to see on the upper left, there's a cloth, and it has the Children's Oral Health Coalition logo on it. You do not have to use Elaine's beautifully constructed cloth. However, we do recommend that it's just the infant washcloths that you can get. They're small enough, they're soft enough, they're what you're bathing your baby with. Just designate some of those to be for wiping your baby's mouth, okay? Well, in just a minute, I'm going to show a little bit, kind of more some demonstration about this. But it really should be started early. You're going to see on the upper right some toothbrushes. The tip here that just popped in to see, no, that's perfect. We want to make sure that you're just like you would brush your teeth twice a day, at the minimum. We want parents wiping their infant's mouth with a cloth at the least twice a day. Doesn't have to happen every single time, because I know babies are eating 2 to 3, every 2 to 3 hours. We do not expect that, but wiping a couple of times a day is going to make a huge difference. And that is really important to educate the parents about that. Not even our pediatricians, I hate to say it, but not even our pediatricians know about this, because guess what? Our nurses, our physicians, they don't get this information in nursing school or medical school. So they don't even know the importance all the time about this. We're trying here at Cook Children's to change that concept and connect the mouth, the oral health to the rest of the body. But it is so important that we really starting these families on the right foot with taking care of their baby's gums. So let's go to the next picture. This is what we like to call a one-person position for an infant at home. Okay, I know I'm on video and you can't, all this stuff, but what does a baby's head do? It's a bobblehead. They're all over the place. An infant does not have control of their little head. So first and foremost, I say that to make sure that you're positioning the baby in the right and the safest way to control their head and keep their body and their head from, wiggling and moving and moving around. Okay, so it's never good to just lay a baby on a bed or, put them somewhere. It's best if you hold them and you can feel and know and see better. We as dentists look at you upside down and backwards, right? Like we have to know our whole world is always upside down and backwards when we're looking. You lay down that way and we look at you from that direction because it is the best view of someone's mouth. So that shouldn't be any different with a parent. A parent should be looking from this angle, sort of on the side, sort of behind, but on the side, and controlling or helping support their head. So I don't have a really cute little baby, but I do have a really cute little puppet. And yes, unfortunately, he has teeth, but we're going to pretend he doesn't at this point. So I'm going to get out of the picture, but I want you all to see. So this is a baby. Yes, they have teeth. Let's pretend they're gums. We have a cloth. It is best to kind of wrap your finger so that you're not sticking the whole cloth in there or doing something crazy, but you need to have control with your index finger. So cover your finger with the cloth, wet it a little bit. We don't want to drench it. We don't want a lot of water, but we want to wet it. You can wet it even with a little warm water just to make it a little warm for the baby. But you just wet this enough to get it in and wipe, and just wipe those gums. You're just getting in there and wiping. And when that tongue that Miss Brenda asked so much about, wipe that tongue. Wipe that tongue. An infant can't swish and spit. An infant doesn't have teeth to even brush at this point. But wiping their mouth with the cloth a couple of times a day and getting that stuff, that white plaquey milk that's just sitting there, get it out of their mouth. That's not only going to help them to make sure that they don't start producing bacteria, and the bacteria, remember, all that makes a nice environment for bacteria to start, actually, even though there's not a tooth. We're going to talk about that issue a little bit later. But I want to say, the more you're doing, like Dad is doing in this picture, of putting that cloth in their mouth and wiping around, you are getting them used to something being in their mouth besides a breast milk or a bottle, okay? And you're getting them used to when that first tooth comes in, they're like, okay, I'm used to this. Mama has your finger in my mouth. Obviously, they can't say that. They're an infant. But it does get them prepared for when it's really super important that first tooth comes in. So let's make sure that we're really embracing and talking about using a cloth and having a parent wipe their child's mouth, okay? Super important. And I love, Elaine has created some great educational materials besides the oral health of pregnant and then the resource brochure, but there's lots of information on just infants and little oral health kits for infants with a cloth and information for that maybe new parent to learn this stuff, okay? Next slide. So this is usually a time when we love to stop and have an actual activity, hands-on activity, where these items that you see in the picture are distributed over the table and everyone's getting to touch and feel and mess with these things so that they kind of know what it is, what they're dealing with, and learn hands-on so that you all who are listening in today, you all are going to be the voice out in the community. You're going to reach way more people than I can alone, than Elaine can alone. So let's talk about what we could do. There are a lot of different toothbrushes. You see a couple of different toothbrushes there, the purple one, the one in the middle with a wrapper, and then you see kind of a little brush with kind of like a two-handle thing. Those are all infant or baby toothbrushes that would potentially be good to start with when they first get their first tooth. The nice thing about the one that people love, and Elaine says this all the people are always like, where do you get that toothbrush in the picture with the two-handle like thing on it? They just don't sell those, unfortunately, really much, at the drugstores or grocery stores or stuff like that. A lot of those are only gotten almost through a dental office. So again, hint, hint, take a child to a dentist when their first tooth comes in or shortly after. Hopefully you can get some of the tools that you'll see here that maybe you can't buy. But there are different toothbrushes for infants. There are different shapes to the handles, the bristles, the way the bristles are either super soft or maybe a little stiffer. I will say, I'm going to say it now and I'm going to say it a lot of times, a soft, bristled, small-headed toothbrush with a nice handle is the best thing you can do for anyone, for an infant, for you, for anyone. It's a soft bristled toothbrush with a nice handle, not a big head to the brush where the bristles are, a smaller where you can control and get it everywhere you need to. When the infant just has gums, we need to wipe their gums, like we just said with the cloth, after they eat, and especially before, quote, bedtime. When they're only a month to 3 months old, they're kind of like eating and drinking all throughout the day and night. They're not really on a schedule. But as they get to that, oh my gosh, mom can sleep more than just 2 hours and have to feed all the time. You want to make sure that that nighttime before they kind of go to bed for maybe that 5-hour stint or that 6-hour stint when you get really lucky, make sure that you do wipe their gums really well before they, quote, go to sleep for the night. You'll see the little, there's at the top of the cloth, you'll see a tube of toothpaste and it says training on it. What that means is this does not have fluoride. This is an infant's toothpaste. And it's not pasty, it's gel-like. It has really no flavor. It really doesn't have much of a color. It has no fluoride in it. So people say, well, why even use it? Well, once that first tooth comes in and you start introducing one of these toothbrushes, it's best to put something on it. Very little, like the training paste, not toothpaste for children. Training infant toothpaste. It's a gel and it's not flavored. It doesn't have fluoride in it. And the purpose of it is to get the child used to something on that toothbrush, the feel of that gel. Because you got to remember, until that first tooth came in, you've only been wiping with water and that cloth. Now, all of a sudden, they have a tooth in. If you only brush it with the toothbrush and you don't put anything on it until they're 2 years of age, when you can start using regular toothpaste with fluoride in it, then they're not going to be used to that. And when you really need to be using the toothpaste, the child's going to be like, they're going to be sticking out their tongue and kind of refusing because they're not used to that. Remember, children are very sensory oriented, very sensory oriented. So especially if you have a child with a sensory issue, you got to start the earliest you can so you set them up for the best success that they can have. The tube of toothpaste that you see kind of towards the bottom in the middle that you see says Crest on it, that one, that is a child's toothpaste. So we really, the recommendation of switching to this toothpaste that does have fluoride in it, we like to say usually start using this by age 2. Now, there are some children, especially little girls, want to grow up so much quicker, and they do things maybe a little bit faster. If the parent feels comfortable that the child can kind of swish and spit or spit out a little bit, you can technically start this a little earlier. But again, this is why it's important to take your child to the dentist. By age 1 or before if you have concerns, or you just want the dentist to see their teeth and do a well visit kind of thing with the dentist. That's who can give you and your child the best information. That is when they can tell you exactly what you should be doing for your child based on, because there's ranges, right? Just like everybody looks at the little chart each time they go in and they've gained, and you see where they are on this. Ooh, we're in the 80th percentile. Ooh, we're in the this, you know. You're hearing all that through a pediatrician, but you need to give that same concept to the dentist and let them tell you what needs to be done. Because every toddler that goes to a pediatrician is going to say something different. There's basics that are said to everybody, but then there's stuff that is said specific and unique to your child and your child's situation. So use the cloth, damp cloth early. Use it even when there's just gum tissues, at least twice a day. Start brushing when they've got their first tooth that comes in the mouth, utilizing the training toothpaste before age 2. And once they get their first baby tooth, it takes very little to put on there. You just need something for that sensory feel. And then also you see here the little pacifier wipes on the left, looks like the wipey bag. We'll talk later about what not to do. But if your child is, or someone's child is really into pacifiers, which are fine. I'm much more into pacifiers because you can throw a pacifier away. You can't throw a thumb away. So if a child, a baby needs, that's a soothing, again, sensory issue. This is something they need to relax themselves, to just suck to fall asleep. That's their comfort zone. And when they're infants, dang it, give it to them. Let them have that pacifier. Even though you're scared that their teeth may come in funny or something may end up different, well, guess what? We'll help you. The dentist can help you and give you ideas of what to do to get rid of that pacifier. But you're just giving it to them to soothe them, right? Just letting them to where they can go to bed. I'd rather them suck on this and fall asleep than suck on a bottle and fall asleep and that milk just sits in there, right? So just saying, given the disclaimer, and those wipes are special wipes that you can wipe down if that little pacifier gets whoop, spit out by the baby and it falls or gets somewhere, then you can wipe this, and this is safe to use to be able to wipe and clean it, disinfect it without there being any harmful things in it that you can't then turn around and put that in your baby's mouth. Okay, so just an added extra little item there. I wanted to describe the importance of that. So, did you know, this is why I was saying it was important, I was waiting for this one. Did you know, and this is Lane's favorite catchphrase, did you know you can catch a cavity? Germs that cause a cavity or that tooth decay, it can be passed from a parent to a caregiver. Now, Elaine in a little bit is going to go over some slides and see what your best thing is here. But the bacteria I've been talking about this whole time, that bad name bacteria, cavity infection, it's Streptococcus mutans. We don't tell anybody you've got Streptococcus mutans, but that is the name of the type of bacteria that is the one that is the most prevalent, the highest type of bacteria that causes the cavity or causes the bacteria, or that's the name of the bacteria that causes the cavity. So you'll see in this picture that the mom is kissing the baby's hand. We all do that. I mean, we just cannot hold a baby without kissing it. We can't. But if you kiss them on the head, that's different than kissing them on their mouth, on their hand. And then a little bit later, that baby puts that hand in their own mouth. Well, guess what? If mom has cavities, she's got that bacteria in her mouth, she can pass it to that baby. Even though the baby does not have teeth yet, that bacteria, it's a long word, if you ever learned this back in the day of schools, is the mom can inoculate. That means she kisses the baby's hand, the baby then puts that hand in the mouth. What bacteria that mom just kissed on the baby sucks on it. There's no source, there's no tooth. So that bacteria doesn't know where to go. So it floats around in your body until tooth comes in. And if you have inoculated and introduced that bacteria to the baby, that bacteria is going to wait until that tooth comes in. That is the other reason why it is so important for that mom, that pregnant woman, to take care of themselves, not only before and prior to the baby coming into this world, but after the baby. Now, bacteria can be passed from other family members, kissing, doing the same thing, but it's much higher, much higher chance of mama passing it to the baby. Decreased chance of others in the family or the household that would inoculate that baby. It's just because that baby was born with that mom, right? That so they have those same similarities that first part of their life. So I'm going to stop talking about this, and I'm going to let Elaine kind of go over some stuff for y'all to see and think about the pictures you see.
Thank you, Dr. Fuqua. Leah, if you will click, guys, this is called Have You Ever? So you're going to need to unmute yourself. And you can also put it in the chat box, but on this one, hold on, one at a time. Have you ever shared a spoon with your child? Or tasted their food and then put it in their mouth? Have you ever done that?
Mm-hmm.
Yes. Several of us have. Next, click. Have you ever blew on the food, your baby's food, before giving it to them?
Yes.
Or better
Yes.
still, have you ever blown out a candle on a birthday cake?
Yes.
Ooh, scary thought there, right? Next, click. And Dr. Fuqua kind of mentioned this one already. But I know y'all haven't done it. But have you ever dropped that pacifier, fell on the ground, and you picked it up and you
Stick
might
it
have
in your
cleaned
mouth?
it? Yeah, you might have done that.
Well, there's a 3-second rule.
Yeah, no, not so much.
Okay, I'm guilty.
It's amazing what we didn't know and the children survived, right? Click. And Dr. Fuqua did mention this one. We've all kissed that baby's fingers, right?
Yes.
And they do go straight to their mouths. Click again, please. But I know y'all haven't done this one. Shared a toothbrush with your husband, child,
No.
anybody?
No.
No.
I don't think so.
You'd be surprised how often that really does happen, especially with families where toothbrushes are not around a lot. And that's why we try to give out toothbrushes, because there's actually people that don't have them. And the parents will actually take the child's toothbrush and the child's still without a toothbrush. Click. Okay, now I know y'all have never shared a straw with your child, your husband, or anything like that. And we know
No,
teenagers in
never.
high school don't do it either, right?
Never.
Those straws will get you in trouble every time. So those are a few of the things that can cause tooth decay. And now Dr. Fuqua, I'm going to give it back to her. She's going to give you some tips on how not to do these things, what you can do instead.
All right, thanks, Elaine. That was just a little activity that we kind of like to make you stop and think, because these are just things that we do without even thinking. I mean, all those pictures Elaine just showed are normal activities that all of us have done, that I sit there and witness while at a restaurant, or I sit there and witness when I'm out and about in the community. You see these things, and it's hard. It's if you're thinking about it in advance, you might have those items that you need to prevent you from doing those kinds of things. So how to avoid passing that germ or that bacteria or that potential bug, those sugar bugs, I like to say. Kids respond to that a whole lot better with talking about sugar bugs. But you know, some of the things you can do is make sure that you do not share a cup or straw, right? Have your own drink, have your own straw. If you want to start introducing a straw to a child to see, you know, how they can do, let that be their own straw. Don't share the straw. You don't literally have to drink it from it to go, see, little baby, this is how you do it. they will figure it out. They're used to sucking. That's what they've been doing with the bottle and or the sippy cup, right? If you've transitioned from the baby bottle and now you're transitioning to a sippy cup, they're learning that natural sucking kind of motion. So they'll figure it out. You don't have to share the straw with them to get them to understand how to use it. Now, not sharing spoons or other utensils, forks. One of the big things that you'll see, I see all the time, is people blowing on their food. It's hard not to, and especially when you're at a restaurant, you're trying to like hurry up because they're getting antsy maybe, and they're sitting there and they just started maybe on some Gerber or cereal, and you're like, oh, it's still too hot. Don't ever taste the food before to see if it's too hot, and then give it to the baby right off that spoon. Just cool it down and wipe it, stir it, stir that food. Get it where just the movement will help to start cooling that off sooner than later. Just when you start these practices and you talk about this before, again, knowledge is strength. Knowledge can get you so far. People do these things because they don't know that that's a problem. They don't know that it could potentially lead to something, okay? The mom could be completely fine and cavity free. However, you don't want to set that precedence. You don't want to start doing these things that's going to set you up for doing that the whole time, and then there being a problem down the road, right? So if you practice it early, hopefully that pertains on and goes on with how the baby grows up with not doing the things that we just talked about. Again, how to avoid passing those germs again is do not share your toothbrush. I know that most of y'all, I even heard some of you, like, I can't see you right now, but I bet you your face is winced a little bit. You're kind of like, that's just gross. Well, guess what? Our families, our low-income families, these families that are struggling, they do share a toothbrush. They do share those things. And guess what? That is kind of the worst thing that they could do. That's why I was talking about earlier. If all they can do is get a toothbrush from the dollar store and it's not the best type, I would rather them get something than nothing at all. We will talk later about the proper toothbrushes, the soft bristle, and why it's important for all those things. But again, sharing the toothbrush is, and we still hear it to this day. We talk with community partners. We'll talk to church groups. We'll talk to different community folks out there that say they're hearing this. They're hearing families talk about sharing toothbrushes. They're talking to kids about a toothbrush, and the kid says, I don't have my own. I don't have one, so I don't get to brush. Again, I can't emphasize enough that if you're doing something out there in the community and you need oral health kits to give out when you're training, because it's kind of counterproductive if you talk about all this stuff in the community with families and then you don't give them the tools they need to practice it and actually do it. That doesn't do a whole lot of good. It does a lot, but it doesn't do everything. So make sure that you're talking or communicating or getting in touch with Elaine if you need oral health kits to distribute out into the community. And she has age appropriate and different sizes for things. So she would need to know, not only how many people, what are you talking at, what are you doing, what is the age group? Because she can either give you infant kits or toddler kits or the young child type kit. Do not place a pacifier in your mouth to attempt to clean. I loved the 3-second rule thing. I love that. Parents say that, 5-second rule, 3-second rule. It just fell, they pick it up. At least it needs to be rinsed off with water at the very least. I will say, as you all know, and some of you who have children know, that with the first child, everything is sterilized. Everything's so clean. Everything is, oh my goodness. And the second child comes along and they're like, lick it, put it back in their mouth. No, let's don't do that. But let's really stress the importance of not sharing, because if you set that precedence of not sharing spoons and straws and toothbrushes and all these things that would go from one mouth to another, that sets that child up from not sharing with someone else, right? Because what happens when you get a little older and they go to daycare and they just, oh, their friend shared something with them and they're both drinking from the same cup now. Gotta be careful with those kinds of things. If you set it up right from the beginning, the child's going to be used to that same routine. I have heard it over and over. No, my mama says I can't share with you. They're not being ugly. They've been taught not to. And those are important things to tell them of how they can stay healthy. And kids are smarter than they either look or smarter than we think they are. They are. And they pick up. They're sponges. At a very young age, they are sponges. And what do? They mimic everything you do. So you've got to set precedents of what you're doing to be a good role model for them to mimic, right? You also want to make sure, a lot of times we talk about, the mom. That's pretty much all we've been talking about right now. Pregnant mom. Okay, now mom's delivered the baby. Now what do we need to start doing with the baby? This is just as important. And I loved Elaine's passion always to say, we need a man in the picture. It's not just what happens with the mom, but dads need to know this stuff. Dads typically don't always go to the doctor's appointments. They are not the one that takes the baby for all their well child visits and stuff like that. But guess what? They are with them at home. They're with them. So dad needs to know the same things. Dad needs to have his oral health in check to make sure that he is setting up his own child for the best thing. Maybe it's the only parent is a dad. So we can't assume anything, and we need whoever is the caregiver to the child to let them know all those important things. And speaking of that, and caregivers, nowadays more than ever, grandparents are taking care of their grandchildren. And those grandparents need to know those same things. Because what you practice at home, maybe there needs to be a toothbrush at Granny and Granddad's house, right? Maybe they need to have an extra cloth. They need to have those things that you use at home to set that child up. And those grandparents need to know to not blow on the baby's food and to not share and all that good stuff. Grandparents don't always listen. I know that because I'm a dentist and I've told my grandparents, my kids' grandparents to not, nope, they can't do this. And then they laugh and send me a picture. They're eating an ice cream sundae at 10 o'clock at night. And I'm going, oh, please make sure they brush after this. But all we can do is knowledge is power. And if you don't talk about those things that you feel is important for your child, those grandparents won't ever know, right? So make sure you folks that are out in the community and talking and engaging with these families, make sure you do mention the grandparents, because we hear it over and over and over again. I know I try, but they're at the house all the time with their, the grandparents take care of them. Well, then they need to know if they're with them all day long while you work, then a grandparent needs to know. And not only that, maybe you'll teach the grandparents something they didn't know, and then they'll take care of their own teeth and be healthier for it. So we went over an awful lot of stuff today. The importance of why to take care of your teeth and your oral cavity when you're pregnant, and what happens to a pregnant female, and how all that can affect their baby. These kinds of things are not talked about in normal conversations, but everything that each one of you learned today is something that can so easily be brought up in a conversation, so easily brought up with a family member. I hear this over and over as these train the trainers have occurred, and these years where there's been hands-on stuff. It makes my heart smile when I see the folks that are in these trainings say, oh my God, I have my own children. I don't even do that. Oh my God, I had no idea. Oh my goodness, I was, whatever it is. This is, we know that this is not common sense stuff. But when I say it out loud and y'all listen to it, you're probably going, well, that totally makes sense. Why didn't I think of that? Well, guess what? You didn't go to dental school. So you're not supposed to know that stuff. That's our job as dentists, is to inform, to give the information, to teach that information. It's our job to help the public to have the best oral health they can have. But if they don't even know to get to a dentist, none of that's going to be able to be done. So I cannot express enough of stressing the importance of prevention, the importance of oral health to overall health. We all need to be talking in that way, in that format, so that things will change. It's just like everything else we're talking about with health equity, with all this other stuff that's happening in our world. We need to be able to have access to care. We need to be able to educate. And hopefully, if we can educate and do all the prevention stuff and give the tools that these families need, maybe we won't have to go into the full treatment mode and talk about, that kind of stuff. I'm hoping we can talk about, more prevention. I do want to say, we're going to talk about a little bit of stuff later today, but just like we don't want to put a baby to bed with a bottle and let them suck up and prop that bottle up. First of all, that's not safe to do. You don't prop up a bottle for an infant to suck on until they fall asleep. That is not safe, and they can choke. And the other thing is, then that milk really is pooling in their mouth. The other thing is, don't put them to bed, with a sippy cup. People think, okay, well, it's not the bottle, but it is the sippy cup. And getting off that bottle by age 1, going to the dentist by age 1, that's when really the magic starts happening, right? If you're doing all that wiping of the gums, your parents are getting educated, they kind of know what to do, but by age 1, they have 4, 6, or 8 teeth by age 1. It depends on the child. My own child didn't get teeth. The second one didn't get teeth till they were almost 14 months old before they got their first one. So, make sure that we're sharing the information. We understand that it is a challenging world in normal years. And right now, this is through a pandemic. Families need more help and support than they've ever needed before. And guess what? This is all because of COVID. Where does COVID spread? Respiratory, right? Our mouth and our noses. That's why we're all, and it can spread through the eyes as well. But mouth and nose is the biggest area. And us wearing our masks right now, us in dentistry are seeing people getting cavities. They're fracturing teeth because they're stressed. They're having more issues than they've ever had before. They're having oral lesions in their mouth. And it's because you're breathing this air, your own air, over and over and over again. So guys, if it wasn't important to get to a dentist before, now through a pandemic, it's more important than ever for us to be able to help you to have the healthiest mouth you can, to then be able to take care of not only yourself, but to take care of your children or others. I am going to just encourage you all to use this information. It was a lot. I know we can't expect you to remember all of it, but that's the beauty of Elaine, because she can share all this information and get you anything that you need, or to help support you and your efforts out in the community. Elaine is one person. I'm one person. Leah is one person. But even us 3 together, we still can't impact our community without all of you. So it's really important to have you guys on board, really important for you to share this information in day-to-day type conversation. It doesn't have to be random. They just asked about my mouth. Why are they asking about my mouth? We're talking about I can't afford to get food on the table. Well, if they have one kind of problem, they probably have others, right? So don't ever think it's random. And anytime you're talking to somebody about anything or any kind of need, oral health should be brought up about their, especially if you're talking about overall health with them. All right, Miss Elaine, I'll let you take over or mediate questions people may have.
Okay. Let me say, first of all, thank you, Dr. Fuqua, for presenting such great information around children's oral health, the importance of it, and all of that. So thank you so much for this increase in knowledge. at the end of the day. And what I will also say, no matter how many times you hear it, you still learn something new every time. So you were talking about some things with the mom and how what was happening in her mouth goes down to that baby, and you gave some great examples of that, and it's showing up in the baby's teeth, and it's like, wow, you knew it affected the baby, you just didn't know in that real visual sense of looking at it in that way. So I learned some new things today, Dr. Fuquay. Um, guys, the session, we go to 11:30. We're a little bit over time, but we have a couple of things, and I really do want you all to be able to ask Dr. Fuquay some questions. Leah, will you click for just a second? Click the slide. Thank you. We have an online evaluation that you guys will need to do for us. And I will also send this link in the email so you can still get it done today, but you'll have to do this evaluation as well as the one tomorrow. So I didn't want to let you go without at least giving you the opportunity to do it before you leave, but I will put it in an email to you because I really do want you all to feel free to ask Dr. Fuquay any questions that's on your heart to ask her about your families or something you're seeing or dealing with. So thank you. Now I'm going to give it back to Dr. Fuquay so you can ask her some questions, but I'm going to just leave this slide up. So if you can fill out the survey and use the QR code, great. So the floor is open for questions, and I will look in the chat box to see if there's any there.
Okay, I do want to, don't be scared to take this little, it's not a test, guys. It's not about, did you learn anything today? We caught you, you weren't listening. It's not that. This is an evaluation for us to know, what did you know beforehand, or what did you learn from us today? And you're going to have some choices in there. And then it's also going to just give us information to know how we can make this better. This is our very first time to ever do a train the trainer in a virtual format. As you know, I move around, but oh my God, you should see me when I'm standing and I get to be in a room with y'all. I'm all over the place. I love to be engaged. I love to demonstrate. I love that hands-on approach. And so any feedback you all can give us will be very helpful to make sure that if this is the world we're going to live in for a little bit longer, or heck, just to have this a recording and share with people, we want to make sure that we're being the most effective we can be. So please fill out the evaluation for us to know what we can do better. Now, any questions, anybody? We're going to get into more stuff tomorrow. So I hope that you're going to be able to jump on and be with us tomorrow, because you'll get hands-on feel with a toothbrush and how and what, and all the ins and outs of toothbrushes, how to brush, how to floss, the difference with all that, and have some hands-on approach with some things as well.
And I just love this deck. I'm very excited about it and looking forward to sharing this with my department and one of our departmental meetings to start, spreading the word. It's a great deck.
Great.
Thank you.
Thank you for sharing that, Cassandra. And remember, when we went to break, one of the pictures that Elaine put up was the actual kit, a train the trainer kit. And this means if you're going to be an individual or your organization has people that are going to be out in the community at some point, or to help train or talk with families, all the little fun things and tools and things that you're seeing in here is part of her toolkit. And it will have training information and all that good stuff on, so that you don't feel like you're going out there going, oh my God, I can't remember everything that crazy Dr. Fuquay said. She has it all so nicely planned out for you and so easy to use. So just please remember that as well. We have the stuff you need to go out and train if you so choose to.
Yes. And now we also have the recording that you can listen to again. So after tomorrow's session, I will send out both trainings that you all have access to. And guys, let me just do a promo for tomorrow's training. We're going to go over some brushing, flossing techniques. We're going to talk about some prevention tools that you can use, different things like that. It is going to be a fun, engaging day with lots of good information coming from Dr. Fuqua. So don't miss it. You'll want to be there.
And by the way, with that being said, Elaine, that just reminded me to mention to you guys, this is recorded. So if you so choose to be able to use this Talk with Elaine, where you could maybe even show this presentation somewhere, kind of a thing that we've envisioned is, okay, you maybe show a recording, but we could also set up a live Ask the Doc time where you show this at your organization or with your family member or with whatever you're wanting, to show this to train more people. Because again, it's train the trainer, train, the triple, that effect that kind of trickles down. And if you want or feel there's a need, we possibly can set up a time where you could ask the doc. You watch the videos, you show the videos, you do whatever, and then maybe you could set up a time to ask the doc. So just letting you know that we will try to be as accommodating and helpful as we can.
I would not recommend using this one for a school. There's probably pieces of it because it's a lot of information, and then two, it's geared more of training you as opposed to talking to the teacher, the kids, or the parents. Well, the teachers would be probably, the teachers themselves would be fine, but when it comes to parents and kids, I'm thinking you'd want something a little different. And I don't have anything recorded, but I think we do have access to some other materials that we can share with you. Yes, to that piece of it. And it'll be based on the audience because some of it is targeted to specifically the kids. And we're working on pieces for the parents as well, just so you know.
Yes, and we are working on several of the things. Again, this is the beauty and the good positive stuff that has come out of COVID, right? Is that so much stuff has gone virtual. We've had to, right? We've all been forced to go virtual, or you're doing nothing. I mean, so we are working on some videos that are towards kids. We're doing that with the Save a Smile program, but we're hoping that, and those are videos that the teachers can show children of different age groups and about different topics. So we will have some more videos in the future that could actually be played towards parents or children for learning purposes. But again, Elaine's Train the Trainer in a Box has the puppets, has the cloths, has all the, lots of stuff in there, and kind of like a guide or what do I want to say? Not an agenda, but just kind of a topic. Oh, what? Yeah, like a checklist or a list of stuff to talk about, with the families. So at least you're not going to give them all this information that we went over today, but we have to give you all the context of the information so you could understand the why, so that when you're explaining it to parents in their own language, their own words, it's just, health literacy is a big thing, but all of the brochures that Elaine does, they're all in English and Spanish for sure. So every handout or brochure, which I dropped my one, everything's in English and Spanish. So just for you all to know, at least the things you'll hand out to families are in different languages.
Yeah. And they're designed that if you are talking to a parent one-on-one, or, just pregnant mom, whoever it is, it's enough information on one of our slim cards and one of our bifolds that will cover enough conversation for 5 to 10 minutes to give them some basic information. And the way they're designed, they feed on each other, but there's enough in it if they don't get another piece, if that makes sense. So they'll be helpful in whatever setting is the bottom line.
And even if you guys, I just want to give you even if you don't know what you want, even if you don't know what you need, if you just send Elaine an email, and if everyone's gotten the evaluation, we can go to the next slide to show Elaine's contact information, but reach out to Elaine and say, okay, I think we're going to talk to this group, the age group, kind of give some background information on what you're wanting to do, but you just don't know what you should use or do. Just give her some information, and then she can guide you to say, oh, we have this, I think this would be helpful, or oh, I know where you can get that, let me connect with this organization. Oh, you want someone to come out and do a presentation? You don't want to do it, but you know the importance and you steer. Oh, well, that she can find somebody. So even if you don't know what you don't know and you don't know what you want and need, reach out because Elaine is very good about connecting the dots for you.
Any other questions?
Y'all are never going to look at a pregnant woman the same, are you?
Good. And you shouldn't. And you shouldn't look at them. Thank everybody. Thank you so much for being a part of this today. And I will see you tomorrow. And have a great day.